You're watching this video because a doctor wants you to understand what's involved in a clip ligation of intracerebral aneurysm, simply known as a clipping. This is surgery to prevent an aneurysm from rupturing or bursting again. You'll typically have general anesthesia, also known as being put to sleep. The patient is usually positioned on their back, side or front, depending on the location of the aneurysm within the head. A metal clamp may be used to hold the head safely. Some of the hair will need to be cut or shaved to prevent infection getting into the wound. Where this will be and how much hair is removed will again vary depending on personal requirements. To begin, your surgeon will make a cut in the skin of the scalp. Special drills are used to make a variable number of holes in the skull. They're designed to stop if they reach anything soft. A special bone saw with protective footplate is used to join the dots and a window of bone is opened. The incision and bone window will vary in size, shape, and position depending on your personal requirements. In this video, we show a larger than average incision and bone opening. Most are smaller. The tough lining around the brain, known as the dura, is then opened to reveal the brain. The surgeon will then carefully navigate to the aneurysm. This can vary between patients, and the path to it will be chosen by the surgeon to cause the least damage to important structures within the brain. Any blood clots will be carefully removed. The surgeon will then apply temporary clamps on either side of the aneurysm to prevent it from bleeding while they free it from surrounding structures. There are different tools, techniques, and equipment that may be used depending on what they encounter. The surgeon will take time to minimize disruption to microscopic blood vessels in the brain. When the aneurysm is free from surrounding brain tissue, an appropriate sized and shaped titanium clip will be placed across the neck of the aneurysm. It will be placed such that it will prevent blood passing into the aneurysm from the artery. To confirm this, the surgeon may use a special fluorescent dye to examine the blood flow using an operating microscope. It will reveal if the aneurysm has been successfully closed off. Once satisfied, the surgeon will make sure any bleeding is under control before closing the dura and bone window. If the brain is visibly swollen, the bone window may not be replaced until a later date when it's safe. If the swelling is minimal, the bone will be replaced. There are different ways to do this, but usually involve screws, plates, or bone clasps to reattach the bone. The healing process will fill some of the gaps left behind, but there may be permanent small bumps that you can feel. This is usually, but not always, covered up by the scalp and hair. To finish, the surgeon will close the scalp with stitches or staples. There may be a drain left in place to drain off excess fluid from the surgical site, which will usually be removed in the first few days after surgery. There's usually a wound dressing and a head bandage may be applied as well. Please ask the neurosurgical team for a personalized post-operative plan after the procedure is finished. Between 1 and 5 in every 100 patients suffer from minor or treatable complications from this surgery, such as infection, which is when bugs get into the wound. You may need antibiotics to treat it. Bleeding or bruising. You may get a black eye if the bruising travels downwards. This usually resolves on its own over a few weeks. Seizures or fits, which are a sudden uncontrolled electrical disturbance in the brain. It can happen because of irritation to the brain during or after an operation. It's treated with medication that reduces seizure activity. Headaches. Some patients suffer from these after surgery. This is often temporary, but it may, unfortunately, be permanent. CSF or cerebrospinal fluid leak, which requires you to stay in the hospital slightly longer to ensure it heals up before you can go home. If it doesn't stop on its own, you may need a drain or another operation to fix it. Hydrocephalus, which is a buildup of fluid within the brain. This may require a drain to be inserted during the operation or at a later date. Pressure on skin, nerves, or eyes. Problems with positioning during the operation, which might include pressure problems, skin and nerve injuries, and eye complications, including, very rarely, blindness. Special gel mattresses and operating tables are used to minimize this. More serious and sometimes untreatable risks include stroke, which is a type of brain damage. Brain operations can cause strokes in up to 5 out of 100 cases, but can be higher, depending on the area of the brain being operated and the abnormality. A stroke can lead to weakness, paralysis, problems with sensation, speech, memory, vision, concentration, or personality changes. If it's a large stroke, you may not wake up properly. The changes you experience will depend on the area of the brain affected. Different parts of the brain have varying functions and importance to your ability to live your life normally. There's no medical treatment that reverses a stroke. However, in some cases, the brain forms alternative pathways to help overcome the problem caused by it. If you suffer a stroke, you may require a prolonged period of rehabilitation at a rehab center or even at home. It may significantly affect your ability to work and live your life fully. Medical or anesthetic complications, such as blood clots in your legs or lungs, which may affect your breathing, heart attack, and other medical or anesthetic problems can occur. Death. Rarely, death as a result of damage to major blood vessels or vital brain structures. If one of these uncommon risks turns into a complication, extra procedures may be required, such as blood transfusion or further surgery. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.